DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. Glad you joined us today. We're going to have a great show on parasitology with Dr. Greg Hanslechek here from Kansas State University's Veterinary Diagnostic Laboratory. We're glad you joined us, and I hope you enjoy this show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Greg, welcome to the show.
Glad to be here.
Folks, this is Dr. Greg Hanslechek. He is a veterinarian, and he is with the Veterinary Diagnostic Laboratory here at Kansas State University. Does a lot with field investigations. You do a lot of work. He has a lot of experience as a bovine practitioner, and we're lucky to have him here at Kansas State University serving our state and beyond the boundaries of the state, and thanks for being here.
My pleasure.
So we're going to talk about parasites, and there's all kinds of them, right?
Lots of parasites, yep.
Externals, internals, different types of internals, but let's start by talking about the ones that are buzzing around out there around our head in the summer.
The flies right
Yep.
now, and we're getting into fly season, and if you drive around the country, you'll see the cows are now starting to be irritated by the horn flies and the face flies, so yep, it's an important topic.
Yep, and some of the things that, you're exactly right. We see the cattle bunching up and swishing, and of course we're going to have some issues that follow with the flies, but what are some of the things or concerns that we have with the flies with cattle?
Well, and it depends on what type of fly we're talking about. We talk about face flies. They're flies that they spend a very small amount of time on the animal. They feed on the eye juices, the nose juices. The thing we're worried most about them is pink eye.
Right.
They transmit the bacteria from animal to animal. Talk about horn flies. Horn flies are actually the ones on the back, and you know that, but
Yep.
I don't know why we named them horn flies, but they're not on the horns, but they're bloodsuckers, and they feed 20 to 30 times a day. And if you go out there, and especially if you look at those bulls, they have thousands upon thousands of flies on them, and they're an irritant. So they keep the cows and the bulls and the calves from grazing, from nursing, from producing milk and doing those kind of things.
Cool. And so we have different types of diseases, and everybody associates the pink eye and vector-borne type diseases. What are some of the things that people are doing these days out there to kind of help with the flies? What are some management practices that we can enlist or use?
That's a great question. Number one are fly tags.
Yep.
Use of the insecticide fly tags. Of all the things that we can use, it probably is the most effective. And I say that because we really don't have control over the face flies because they don't spend enough time on the animal. If we use pour-ons or back rubbers or any of those kind of things, those flies come and go, so they don't have much experience or access to the insecticide, but the fly tag helps with those. But the fly tag also helps with the horn flies and the other flies we're concerned with.
Yep, and then I'm assuming that there's some things we can do environmentally, knocking down weeds and cleaning up old bell rings and things to that nature as well.
There is, because the face flies and the stable flies, they don't spend any time on the animal. They live in old vegetation and rotten feed and those kind of things. So cleaning up those areas will reduce the area where they can lay their eggs. So that's a good fly control program for them environmentally.
Cool. Well, we're going to take a break. When we come back, we're going to talk with Dr. Hanslacek on parasites, and we'll move from outside the cow to inside the cow. You're watching Doc Talk, and we're sure glad you joined us.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment.
Brendan Martin was raised on a beef cattle, poultry, and crop farm in Virginia. During college, he worked and interned in the cattle industry while raising his own Angus herd. As a result, he became interested in bovine reproduction and the power of genetic progress within a cattle herd. After graduation, Brendan started Valley Herd Health in Virginia, working mainly with beef and dairy cattle.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to Doc Talk. Dr. Dan Thompson, Dr. Greg Hanslacek, and Dr. Hanslacek is with the Veterinary Diagnostic Laboratory, where you do a lot of different things, wears a lot of different hats, but is always out in the field and always working with practitioners and producers and where the rubber meets the road. And Greg, when we talk about parasites, we'll move from outside to inside the animal. Let's talk about some of the internals and what are some of the different species that we should be most concerned with when it comes to cattle.
That's a great question. Cattle have lots of different species of worms. The main one we're concerned with is one called Ostertagia, and it lives in the stomach. Mm-hmm. Causes certain things like malnutrition, suppresses immunity, those kind of things. Some of the other worms we mainly concerned about, the Capurias. They live in the small intestine. We know that they have an effect on the gain of calves that are in pasture. Homunculus is another one that's not so much in this area, mainly a southeast worm. Those are the three main ones that we're actually concerned about today.
Okay, and so when we're looking at those types of worms, and again, they're all going to affect performance or conception rates or body condition scores and things to that nature. What are some of your recommendations? And of course, we always recommend work with your local practitioner because they're the ones that are living there and know the cattle and the climate and. But what are some of the things, some general concepts on parasite control?
Some of the major things to think about is that, just like you said, most of the effects are things that you don't probably recognize. So most of the problems we have with internal parasites are subclinical. We can't see them unless we actually measure them. The other thing about internal parasites is that it is becoming a controversial subject as far as how we should manage them in the cow-calf operation. But a part of that is that we have to remember that 90% of the worms that these calves and cows have access to are actually in the pasture. Only 10% of them are actually in the animals. And so pasture, how do we control the environment and maintain the environment is very, very important for this disease.
Cool. You know, we have a lot of different products out there. We've got injectable, we've got the ivermectins, the avermectins, we've got drenches, you know, the fenbendazoles, and we've got porons too. Any preferences or any thoughts on that, or use one?
Well, there's two thoughts. One is that we do know, literature shows and research shows that with the avermectins, that compound, we are starting to see some resistance in the worms. But if you look at other countries that use the other products also, we're seeing resistance to basically all those products.
And then the second point would be?
Well, a really good recommendation for producers is let's deworm the adult animals when they go to pasture. That way we're reducing pasture contamination. The calves are going to pick up the worms in the pasture, and let's deworm everybody when we come off the pasture. Let's clean them up. So we're doing two things. We're making sure the pasture doesn't have a high load of parasites, but we know animals are going to pick up those parasites. Let's clean them up when we get off the pasture. It's a pretty simple program.
Yep, and it sounds like great advice to clean the environment and then clean up the cattle as we come off.
Absolutely.
We're going to take a break. When we come back, we'll talk a little bit about coccidiosis. You're watching Doc Talk, and we're glad you joined us.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA tip of the day, we want to visit about fly control. Fly control is a very important aspect to any operation that's running cattle because, as we all know, flies can get very bad in the summer, especially late summer. We have different products and different things we can use to combat flies. Most importantly, we want to focus on it before the fly population is too high. We focus on it afterwards. We can be a little too late to the party. We want to use products that are effective around premises, along bunk lines, but also on these animals. We have to take care of the environment as well as the animals. There are some great products out there. There's some new products that are very long lasting. Products that can be washed off buildings, washed off cement, multiple times, last for several weeks. Again, there are some great new products out there. Check them out. Contact your local veterinarian. He can help you out and give you some answers for your fly control population problems.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to Doc Talk. Dr. Dan Thompson with Dr. Greg Hanslachek, and he is with the Veterinary Diagnostic Laboratory at Kansas State University. And Greg, we're talking about parasites, and one of them I know that you've done quite a bit of work with and looked at is coccidiosis.
Yes.
And you know, a lot of times we don't consider coccidiosis a parasite out in the country. We think of it more as like a bacteria or something we're going to treat for that, because we do treat differently than what we do for our internal parasites. And really, this is a parasite.
It is a parasite, and it is closely related to the cryptos and some of those other things, but it is an internal small intestine parasite.
Okay, and what are some of the, I think one of the things that producers don't understand is how common it is.
It's actually probably the most common disease other than bovine respiratory disease that we deal with calves that are around weaning, just before or just after weaning on the cow-calf side.
And there can be a subacute, kind of a non-clinical carriage of these?
Absolutely. Just like the other internal parasites, what you see is only a very small percentage of what's actually going on in the rest of the animals.
Right. So not only do we have the opportunity of having clinical disease from this parasite, but we can have the subclinical that's causing us lost performance, lost conversion of that grass or that cow's milk or feed when they get into the grow yard.
That's exactly right. And with coccidia, it causes severe malnutrition if the numbers of those organisms are severe enough in the intestine. Those calves are eating what they should, but they're not absorbing those nutrients. And so we've got a malnutrition, which has a huge impact on their immunity. So that's why we know that calves that have a heavy coccidia burden are more susceptible to other diseases like bovine respiratory disease, maybe pink eye, those other kind of diseases. So it's important.
Okay, so how are some ways that we can prevent or treat for coccidia on these calves that are, in at different stages?
Well, that's a great question. One thing to remember is that every facility has coccidia. It's a normal inhabitant of all bovines, and so animals have it, they're passing it through the manure. So one of the best ways to prevent a really severe coccidia outbreak is to concentrate on manure buildup.
Okay.
The other thing is standing water. When we have standing water where an animal with coccidiosis will defecate in the water, now all that cocci's in the water, what do animals like to do? They like to drink out of those. Now we're inoculating the whole population to large doses of coccidia.
Yeah, I used to get into some of those cocci outbreaks on cattle when we'd get into that freeze-thaw cycle where it'd be warm during the day and thaw out and freeze at night, and the cattle would drink groundwater and
Absolutely.
And really have some tough times those times of the year. Any compounds or anything, if I do get into a cocci wreck, that you recommend or think about?
There are some good products on the market, and we're talking mainly products that you'd have to feed in a bunk, so it'd probably post-weaning kind of thing, but Corid, Amprolium, that's a product that's really effective not only for treatment but also for prevention. So those they come in a pellet, you can get them in a liquid to put them in the water or feed them in a pellet. Very effective products.
Perfect. Folks, we're going to take a break. When we come back, more with Dr. Hanslachek on parasites. You're watching Doc Talk. Thanks for joining us.
Hello, I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center, and today, for a horse tip, we're going to talk about fly spray. Fly spray can be all kinds of realms of different things, oil-based, water-based. What's the best thing? If there would be the super save-all and protect-all, everybody would be using it, but it is variable, and it's because fly spray actually gets degraded by sunlight, so that's why it doesn't last that long on the horse, or we think that flies are resistant to it. So reapplication is going to be important. Be careful with the oil-based products because it can cause a dermatitis or irritation of the skin if it gets too thick. There's also different things you can apply over the mane and tail, kind of spot applications. Those can be also very beneficial, not just for flies, but also for ticks and other external parasites that might be bothering your horse.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thompson with Dr. Greg Hanslachek. We're at Kansas State University, where Greg works at the Veterinary Diagnostic Laboratory, works with field investigation. He directs our outreach programs and much more. And we're fortunate to have him here on the show. And we've had a great show talking about parasites. And one of the things that you and I talked about during the break was talking about some of the things that has to do with resistance. And really what I'm talking about is with the flies.
Absolutely. We talked about earlier how fly tags are probably the most used product for control of flies. They are effective, but there are certain things that we need to keep in mind if we're using that product for fly control. And one is resistance. We know that if we use the same chemical product year after year, we're going to breed flies that become resistant to that insecticide. So if people are using pyrethroids and organophosphate tags, which most are, it's important they use 2 years of pyrethroids. The third year they use an organophosphate, then they go back to pyrethroids for 2 years. That rotation will reduce the opportunity for resistance.
That makes a lot of sense. And you know, when we have cows and perennial animals on the farm, important to get things removed.
Absolutely, and that's the other important thing is that fly tags are great, and when we put them in, there's a lot of insecticide there, but through time, that amount of insecticide is going to be reduced. And so if we're not taking those insecticide tags out in the fall and getting rid of them, what we're doing is exposing flies to very, very small amounts of insecticide. So the only flies we're killing are those that are most susceptible to that insecticide, and we're breeding those that are resistant.
And it makes a lot of sense then that, you know, we got the cows caught before we go to pasture, deworm them, put the fly tags in, bring the cows out in the fall. We're going to preg check, just have somebody up there cutting tags out.
Absolutely. That's a simple program that does work.
You bet. I know you do a lot of work at the D-Lab, and I'm kind of putting you on the spot, but you know, what's kind of your philosophy of just producers working with their practitioner?
Of course, I'm a practitioner, and I still consider myself to be a practitioner, but I was a producer once in my life too. But that interaction between producers and their local veterinarian is really key to not only producers thriving during the good times like it is now for cow-calf operators, but really surviving during the hard times, which there's a lot of hard times. That relationship, those producers relying on their veterinarian to provide them with the latest information on prevention and treatment and management of their herds is really vital to everybody.
Yeah, you bet. Well, I know one thing is that you are a practitioner first and foremost, and what you do and how you work for the practitioners of the state and beyond is much appreciated.
I appreciate that. Thank you.
Folks, Dr. Greg Hanslachek, thanks for joining us today on DocTalk. If you want to know what we do here at the vet school, you can find us on the web at www.vet.ksu.edu. And remember to always work with your local practitioner. I'm Dr. Dan Thompson. Thanks for watching DocTalk today, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.